Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go. All right, Nikki, you got some rapid fire for us?
Yeah. Why is having a massage triggering symptoms?
Yeah, so that's a good question. That's usually because your neck is involved in your symptoms. So if you have neck dysfunction that's causing headaches or it's causing some dizziness and you get a massage, you're kind of getting a new neck. And so your brain tries to recalibrate that. And sometimes it flares and sometimes it makes everything go away. So it's generally just a sign that your neck is an issue and you need to just continue getting more work on it.
Great. There's another one here. I'm starting to feel like concussion is like peeling an onion. My back is getting better along with my POTS from daily 30-minute heart rate exercises. Was wondering why my neck kept tightening up right after great treatment. My chiro concussion guy did some eye tests and was shocked that I didn't have constant dizziness and headaches. He's getting me to do figure eights, looking at one point, and I walk like I'm drunk. I was shocked to find how bad this is so far out. He's also getting me to read converting one eye, and anything on the outside of the page is wavy and blurry, and I get headaches immediately. Do you know what this is called and how long it takes to heal this? Could this be permanent after 9 months post-concussion?
It could be neck, it could be visual. So it's hard to say which one. But things like eyes, like things moving on the page is frequently associated with neck dysfunction. Dizziness and doing figure eight turns, that's something we frequently do with concussion patients. And again, that could be all related to neck dysfunction. Why does my neck tighten up right after treatment? It could be a whole variety of things. It could be a sympathetic response like we talked about before. It could be inflammatory. It could just be, your response to the treatment at this time. Is it permanent? I don't think so. I don't think anything with concussion is permanent. It just means there's dysfunction. And so just continue working on those things, continue doing those exercises, and things will improve.
Great. Here's another one. Can fascia massage be beneficial to treat PCS?
Possibly. Depends on what they're treating, what your issues are.
Okay. And then are all myofascial release? Are all massage myofascial release?
Maybe. Like massage generally is like static tissue work. I find that's not as effective as actually doing kind of movement-based tissue work. So like active release, for example, you shorten a muscle, apply a tension, and then you lengthen the muscle. So if I'm working on the SCM, for example, the shortened position is if I pull my ear to my chest and I turn my head to this side, this SCM muscle, and if I turn it away and back, that's going to lengthen it. So when I'm doing work on the SCM, I shorten it as much as I can. So I bring the patient's head up to their chest, ear to the chest. I find a spot that has some tension in it. I put the pressure on it, and then I have them turn and rotate like that as I'm applying the tension. So that's more kind of like myofascial release. Whereas a massage would just kind of do this and work on that muscle. That's not going to be as effective as actually moving it through a range of motion and applying a tension. Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.